So we will be starting with the osteology of the abdomen, which is covered in a previous class as well. In the lumbar vertebra, we are going to cover the sacrum. So before we move into the sacrum, like it's a, before we go into learn this particular bone, there is something which we must focus before we learn the bone as a whole, like muscle attachments and the parts, etc., etc. So this particular bone, which looks like this triangular wedge shaped bone, placed between this particular hip bones, right side, left side, and this particular bone have got some kind of foramens which is present in it. It looks like it's a hollow bone pierced by some bullet holes, like in the front and the back as well. So these particular holes are important for us to understand, and these are exam questions. So there are a few things that you have to understand in this particular sacrum bone. It has a canal which is known as sacral canal, which is a vertebral canal. We see that the vertebral foramen which is united in this particular bone to form a tract, we call them as canal. It's a kind of like a hollow cavity which is having an opening above and an opening down. So this opening down over here has another name. So this particular opening we call them a sacral foramen, and it leads to the canal, and then this particular canal ends on the lower side, we call them as hiatus. So you should be knowing about these terms separately. What do you mean by the sacral foramen, sacral canal, and sacral hiatus? Now other thing about that, this particular bone have got this particular foramens. So this particular foramens, they has present in the two sides of it, anterior side and the posterior side of it. We call them as foramens. This particular foramens belong to the sacrum bone. We call them as sacral foraminas. There are two sets of sacral foraminas are there. One is on the anterior side, one is on the posterior side. So we call them as ventral and dorsal sacral foraminas. And what comes and passes through them are our exam questions. So before you get into this particular bone itself, we must understand this particular area which is mostly hammered or mostly asked about this particular bone or questioned in the examination. Then we prepare this particular bone, makes these things easy for us. These are the foramens which is present in here. Transmitting through these foramens are neurovascular structure. That means we are going to have some kind of nerve, we have some kind of blood vessels that is running through it. So we have to know precisely what going in, what coming out, all these particular contents of this particular bone. Now talking about this particular bone, it's a kind of vertebral bone. This particular vertebral bone was 5 of them fused together to give rise one. So it's a kind of fused vertebral bones. And as you have seen these things as fused or joined together, this particular vertebra, in between these vertebrae, we have a cartilage in between. We call them as intervertebral disc. This particular disc as well is absorbed and fused to form this particular triangular shaped bone. Right. So this particular bone, as you're seeing here, fused bones over there, all the processes like spinous process, lamina, all these particular costal facets, or this particular transverse process, whatever the things are there, they are fused together and giving kind of like this amorphous shape. So having this particular triangular, it has 3 parts. This part we call them as projected upwards, we call them as base, which is a wider part, and this part is tapered down, we call them as apex, as this triangle have an apex and a base. So this upper part we call them as base, this part apex. Apex is tapered down. So united in the lower part, we have this particular small piece of bone, tailbone. We call this as coccyx. So this particular coccyx also fused bone out there, but this particular bone we are studying together. So like this particular bone we will be just like mentioning, not emphasizing on this. So this particular bone, as you are seeing here, have got like a base and apex, and it has margins present on the sides, right side, left side. We call them as lateral ends or lateral margins. So it has base, apex, lateral margins. We call this lateral margins as lateral mass, 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 sides of it. So this lateral mass articulates with the bones on the hips bones, which has got an articular facet and a non-articular part. Some part is forming a joint, some part is not forming a joint. So it's called as articular part and non-articular part on this lateral side. So in this lateral side as well, we have this particular hip bone attached, right side, left side, making a joint. We call this joint as sacroiliac joint. So it is joining with this iliac bone, ilium bone with this particular hip bone, and this particular sides we are joining with the sacrum. These are the synovial flat variety of joint. Sacroiliac joint, right side, left side, corresponds to the sides. Clear? So base. Now coming to these particular surfaces. This surface which is facing this side, we call them as ventral. The other one will be dorsal. So anterior or posterior. Posterior is rough, anterior is smooth. Both of these sides are pierced by this kind of holes. This particular holes is communicating with the central hole which is running through it. The central hole which is present in this particular bone on the back side, we call them as canal. If it is a tube, we call them as canal. The opening of this particular tube have got names. So foramina, which is present in the small holes like this, so we call them as sacral foraminas. Ventral side sacral foraminas and dorsal side sacral foraminas. And this particular foraminas which is communicated with this particular main tube like this. So this particular sacral canal is running throughout the length, and through this particular canal, these particular openings are connected. These are kind of small tributary openings which are joining with the main canals. Now, the tricky part is that what runs through it, this particular canal. So we have this particular spinal cord which ends at the lower part of the lumbar vertebra. Lumbar vertebra have got how many bones? 1, 2, 3, 4, 5 bones are there. So this lumbar vertebra number 1, lower part of this L1 vertebra, we have the spinal cord end that particular point. So lower end of the spinal cord ends at the lumbar vertebra number 1. Lumbar vertebra 2, 3, 4 also have this particular space which is running through it. So what runs through this particular, beyond this particular lumbar vertebra and as well as sacral content is that we have this particular nerves. So we have this particular spinal cord which is the neural tissue, and from the spinal cord we have these nerves exiting, we call them spinal nerves. So these spinal nerves takes a bunch, look like a bunch, like kind of cell, like we call them as like a bunch of nerves which is dropping down and getting in here. So this particular nerve exiting through this particular foraminas and getting out of this particular vertebral canal or sacral canal. We'll be seeing that how this particular things looks like. So this particular continuations of the spinal cord which is remains as the spinal nerve runs through this particular spinal or sacral canal, we call them as chorda equina, or lower end of the spinal cord. Once it ends, the nerves of the spinal nerve still just like a haven't end, it runs down like a bunch of tail of a horse, we call them as chorda equina, C-A-U-D-A, chorda equina. Equina means horse. So horse tail looks like a horse tail that goes like that. We have a visual impressions on this, we'll be talking about. So but anyways, so we have the base, apex, lateral mass, we have this particular canal which is present in here, sacral canal, and these particular foraminas we call them as sacral foraminas, ventral and dorsal sacral foraminas, right? Now if you see this particular next image, we mention here about an word about sacral hiatus. What is hiatus? So this particular thing we are seeing here in the back side. So if you just like trip it on the posterior side, you are seeing the posterior side of the sacrum bone, which is rough compared to the anterior side, don't have this roughness. It has kind of bony ridges which is present in it. So also have got these particular foraminas which is present in here, 1, 2, 3, 4, 5, 6 like this. So these particular foraminas we call them as sacral foraminas, and this is on the back side, we call them as posterior sacral foraminas, also known as dorsal sacral foraminas. In this one we see that these foraminas are there in the anterior side, we call them as anterior sacral foraminas or ventral sacral foraminas. Clear? Now this particular thing we call them as sacral canal. This opening of the sacral canal, and this sacral canal is present in this particular length from here to here. It is covered, and then we have this particular lower end of the sacral canal opening into this particular U-shaped opening, we call them as sacral hiatus. This opening we call them as sacral hiatus. So lower end of the sacral hiatus has a bulbous end, we call them as sacral cornu, but you can forget about the sacral cornu. So we focus about this opening, we call them as sacrum hiatus. Clear? So this opening we call them as sacral hiatus, and lower end of the sacral hiatus has a bulbous opening, we call bulbous end, which is bony thing, we call them as cornu, but you can forget about this cornu. More important to remember about this particular thing is this hiatus. Okay, so this opening, the sacral foramina, canal, hiatus. This one, foraminas. What foraminas? Sacral foraminas. Which sacral foraminas? Posterior. If you have posterior, anterior will be there. The anterior will be on the anterior side. Clear? Alright, again go to the bones. So, this particular bone we have started with. Now, you see that this particular bone is a vertebra. So, vertebra has how many parts? We have two parts in the vertebra. One we call them as body, which is the central part, and then we have the projections, we call them as processes. The processes may be directed to different directions. If it is posteriorly directed, we call them as posterior process, which is posteriorly part, we call them as spinous process. If it is present on the transversely, we call them as transverse process. So, joining them, these particular processes, we have this lamina and as well as pedicel, which is the parts of this particular vertebral bone. Now, this particular bone, which is sacrum, fused every part of it and making this particular shape. Clear? So, this particular part of this particular bone, we call them as sacral body, which you are seeing here. This is sacral body S1 and this will be bottom one S5. Clear? So, this particular part, which you call them as anterior part, which you are seeing here in this particular ventral side, we have this body central part, and this particular part which is fused costal and transverse process. So, this particular part which is fused costal process over there, we call them as ALA, ALA. We call them as ALA, ALA. What do you mean by ALA? What do you mean by the ALA? ALA means wings, wings of a butterfly. So, does it look like a butterfly wing? So, it looks like a butterfly wing, that is why you call them as ALA, ALA, ALA of sacrum. So, this is the body of the sacrum, S1. Now, this anterior margin of this body of this vertebral S1, vertebra, anterior border. This is the anterior border, this is the posterior border. Am I sure? With this anterior border, this is posterior border, because this is the back side, we have this particular superior articular facets there. So, this anterior border of S1 vertebra, we give a special name to it. We call them as promontory. We call them as sacral promontory. This yellow line, you follow this yellow line, we call them as sacral promontory. So, this sacral promontory is very important as well. You have to remember this. So, once again, this part is body, or this part is process, which is united, costal facets and this transverse process, they are fused. This particular thing also part of this body. So, this particular part we call them as wing shaped part, we call them as ALA. So, this superior part we call them as ALA, ALA of sacrum. So, this part, transverse part, on the side, lateral side, we have this ALA, this is the body, and anterior border of this S1 vertebra, we call them as promontory, sacral promontory. Not all these things, only this anterior border of this topmost one, that means S1 vertebra. We call them as promontory. Promontory is a landmark thing. That means we measure some distance from this anterior border. That is why it is important for us to remember. So, you have to remember this promontory. What do you mean by the promontory? And whenever you are given this particular bone, you have to identify the promontory. So, in this particular bone, where is promontory? Ventral side or dorsal side? Anteriorly or posteriorly? Anteriorly. Which part of this anterior part? So, this one is promontory. So, this border, it is not a point, it is a border. So, this border we call them as promontory, and this one wing like ala. Clear? So, this particular ala, if you move downwards on from this ala, we get this particular lateral margins or lateral surface of this particular sacrum. So, this is the lateral surface, this is the ventral surface, this is the dorsal surface, and this particular ventral surface have got like this particular prominent part of this anterior border which is present, we call them as promontory. And then we get this particular ridges which is present in this particular midline of this. So, this is the fusion points of the bones. So, S1, S2, S3, S4, they are united, and this union point are marked with the ridges. So, this particular ridges are present, we call them as transverse ridges. Now, this point demarks at fusion points of these two adjacent bones along with this cartilage which is present in between. So, we have this intervertebral disc which is present in between. There are two also fused in here, and this is projected as this particular margins. We call them as transverse ridges. Clear? Now we move to the complicated posterior side of it. So you see this particular posterior side of it, it looks like a rough. So it's easy to identify this particular bone whenever you are identifying it. So this particular posterior part, we have this particular prominent part which is present in here. So this particular prominent thing which is present in here, we call them as crest. We call them as crest, C-R-E-S-T, crest, like iliac crest, that prominent part, right? So this particular part we call them as crest. Now there are three prominent parts are there. So we name it from midline to the lateral thing. So this is the median thing, midline, and this is the lateral side. So we move from the midline to lateral sides as crest. And if it is present on the strictly on the midline, we call them as these median. If you move to this lateral side, we call them as lateral crest. So this one which is present in the midline, right? Agreeing? So this particular crest we call them as median crest. This one, if you have this, we call them as lateral crest. And in between median and lateral, if you have something, we have to call it in between. We call them as intermediate crest. So this particular bulges which is present, this one again, and this one. So we have three elevations. We call them as crest. So this one is median crest, this one is intermediate, and this one is lateral. So median, lateral, intermediate crest. They are formed by the fusions of these processes which this particular bone has. So this is a spinous process which this particular bone has. This spinous process of the vertebra there, you can feel the spinous process, right? So if you feel something on the back side in the midline bone, that's a spinous process that you are touching. So vertebral spinous process you are touching, you can touch this spinous process. So this particular spinous process are fused over here one after another with this particular thing joining over here, forming this medial crest, sacral crest. Then we have these articular facets. So this superior articular facets and inferior articular facets, and as well as this particular lamina part of it, are united to give rise this particular intermediate sacral crest. And then we have this particular lateral sacral crest, which is formed by the fusion of the transverse processes of the spine. So this particular transverse process fuses to give rise this particular crest. But again, if you cannot remember all this complex story, don't remember it. Just identify the landmarks. If you can have enough space, enough time to remember, then you remember how these particular things are formed. But basic foramens and basic elements which is present in here, crest and these things you have to remember. Clear or not? So how many crests we have on the posterior side? 3. How many crests we have on the anterior side? How many crests are there in the anterior side? No crest. আরে তুই নোটস নিচ্ছিস তো, কতগুলো ক্রেস্ট আছে অ্যান্টিরিয়রলি? ক্রেস্ট কটা আছে? ক্রেস্ট একটাও নেই। আছে? অ্যান্টিরিয়রলি ক্রেস্ট আছে? ক্লিন শেপড। অ্যান্টিরিয়রলি কি আছে? ট্রান্সভার্স রিজ আছে, promontory আছে। Clear? Difference between crest and thing. How many foraminas anteriorly we have? May name it. গুনে গুনে দেখাও। কতগুলো ফোরামিনা আছে? এই তো 6টা বললো কি একটা, না 8টা না 10টা কি একটা বললো। এক একজন এক এক নাম্বার বললে কি হবে? কেউ অঙ্ক পাস করেছিস না করিসনি? হ্যাঁ, নাকি আমার মতো ফেল অঙ্কে? হ্যাঁ, কটা করেছে? ঠিক করে গুনে বল, তাকিয়ে গুনে গুনে বল কটা আছে। How many foraminas anteriorly we have? 8. Any other number? Any other figure? একজন বলেছে 8 আছে, গুনে বলেছে। আর কোনো আর কেউ গুনে বেশি পেয়েছে? পেয়েছে? Anybody have any different number in mind? বেশি বললে বেশি নম্বর পাবো এরকম কেউ মনে করছিস? How many factor foraminas we have? কে 6 বলেছে? কে 6 বলেছে? ধোনির ছাত্র বল কোথায় 6টা আছে গুনে দেখা। ছয় ছাড়া কিছু মানে না, সব হেলিকপ্টার শটে ছয় মারে। ছটা গুনে দেখা তুই, আয় চলে চলে আমার কাছে, চলে এখানে, চলে ছটা গুনে গুনে দেখা তো। এই ক্যামেরা ওদিকে দেবে না, আমার দিকে দেখো, নায়ক আমি, আমাকেই দেখাতে হবে। ও খালি গুনে দেখিয়ে দিয়ে চলে যাবে। ছটা গুনে গুনে দেখা, ছটা, ওই ছটায়। আর দুটো চোখ কোথায় গেল? ও গুনবে না কেন গুনবে না? কি অপরাধ করলো ওরা? বুঝতে পারো না, আচ্ছা ঠিক আছে, এবারে গুনা দেখো কটা আছে। আটটা আছে তো? তাহলে সামনের দিকে আটটা, তা পিছন দিকে কটা থাকবে? আটটাই থাকবে, ছটা থাকবে না তো? যদি ছটা থাকে, দেখো গুনে দেখো, গুনে দেখে নাও বাবা। টাকা পয়সা যেমন গুনতে হয়, এটাও গুনে দেখে নিতে হয়। কটা আছে? পেশেন্ট পয়সা দেবে তো? হ্যাঁ, চেম্বার করলে পয়সা দেবে তো? ফিস কত নেবে? বা শুনি না, এখন ভেবে বলো না, কত ফিস নেবে? 600 টাকা। আচ্ছা, গুনে নেবে না গুনে নেবে না? ওই তো ওতেই হবে, 400 টাকা দিয়ে চলে যাবে তো? বলবে 600 টাকাই আছে। বিশ্বাস, কে বলছে বিশ্বাস নেই? গুনে নিতে হবে, পায় পয়সা। কটা ফোরামিনা আছে সামনের দিকে, কটা পেছনে আছে, সব গুনে নিতে হবে, ঠিক আছে? কি বলেছি আমি? ফোরামিনা, তাই তো? এবার যদি হায়াটাস বলতাম তাহলে কি হতো? কটা হায়াটাস আছে? হাউ মেনি হায়াটাস উই হ্যাভ? কি হায়াটাস? অ্যান্টিরিয়রলি কটা হায়াটাস আছে? পোস্টেরিয়রলি আছে। আর ফোরামিনা অনেকগুলোই আছে, সামনে পিছনে। আচ্ছা, ক্যানাল কোন দিকে থাকবে, সামনের দিকে না পিছন দিকে? পিছন দিকে থাকবে, সামনের দিকে নেই তো? গুনে নেবে তো? গুড, চলো, গুড জব, গুনে নেওয়া অভ্যেস করতে হবে। So coming to this particular bone, again this part we call them as promontory, anterior border of S1. This part ala, ALA, right side, left side. This side we have this surface. Which surface? Ventral surface, dorsal surface, pelvic surface or anterior surface, right? It has foraminas. How many foraminas? 8 of them. And in between this particular vertebral bodies we have these ridges, we call them as transverse ridges. Posteriorly we have these bumps, we call them as crest. How many of them? 3. We name it accordingly, right? In between crest what we have? Foraminas is there. In between which crest we have these foraminas? Intermediate and lateral, right? So we have these particular foraminas, and how many of them we know that count. And hiatus, which is the downmost opening, which is U-shaped, we call them as sacral hiatus. This is opening of the sacral canal or sacral foramen, which is leading to this particular canal. If you slip through, we can get this particular contact over there. Now, so these particular transverse bars are there over there, which is present. Now coming to this particular muscle attachments over this particular one, we have two muscles to remember in here, anteriorly and posteriorly, which is attached here. This particular muscle which you're seeing here looks like an E-shaped structure, epsilon structure, which is present in here. This one we call them piriformis. And on this side we have a muscle which is attached on the lateral angle or lateral part of this particular lateral mass. On the ala superior side we have this muscle attached on here, we call them as iliacus. So these two muscles we have to remember. No, sorry, erector spinae, sorry. Here we have a muscle, we call them as multifidus, and lateral to it we have a muscle, we call them as erector spinae. So which is a muscle which is keeping the spine straight. So these two muscles we have to keep in mind regard to this particular thing. About in the medial side we have this one piriformis, and this one is so piriformis is this one, and this one is iliacus or something, I do not remember actually, it could be coccygeus as well. So this one I have a doubt over, right? iliacus or coccygeus? iliacus তো একটু দেখে নেবে বইটা, ঠিক আছে? আমার ঠিক এক্স্যাক্টলি মানে ইয়ে হয়ে যাচ্ছে, কি লেখা আছে? iliacus লেখা আছে? আচ্ছা, তবুও বই থেকে একটু ক্রস ভেরিফাই করে নাও এখন। আর পিছন দিকে দুটো মাসেল আছে, মাল্টিফিডাস, MULTIFUDS, ফিডাস, অ্যান্ড আরেকটা স্পাইনে। দুটো মাসেল এই জায়গাটাতে অ্যাটাচ থাকে। এই দুটো মাসেল মনে রাখতে হয়, হ্যাঁ, এই দুটো একটু মনে রাখবে। Now coming to this particular joint which are formed by this particular bone, over here we have this particular lateral mass. So this particular area we see that as a lateral mass which is having a two part. This is upper part and then we have the lower part. So this upper part which is lined with this particular yellow lines or yellow colors like this, we call this the articular part. That means it's making a joint. Which joint? Sacroiliac joint. So this articular part on the lateral side or lateral surface which is present in here, we have this joint forming in here. Lower part we have this particular thing which is not articular part. Here has ligament attached to it. So this particular ligament which is present in here is sacrum to ilium bone. So sacroiliac ligament which is present and joining in this region. So we have this particular depressions over here, and the lower part as well we have these depressions present and continuous. We have this ligament attached to it. So we have this particular region which is marked with the color which is joining with the bone. We call them as articular surface, joining with this opposite side or corresponding side of the hip bone, which makes this particular sacroiliac joint, which is a synovial variety of joint, and under to it which is non-articular part of this particular lateral surface which gives attachment to the muscles, and as well as some of this particular region we have the attachments of this particular ligaments. We have the ligament, we call them as sacrum to ilium bone, we call them as sacroiliac ligament, sacrotuberous ligament. There are several ligaments attached to it. So I just do not want to complicate with these names of the ligaments, because when you study this particular pelvic bone, we'll talk about the ligaments, then it will be like an appropriate time to discuss about the ligaments. So remember that this particular thing have got ligaments attached to it, but this at this time we focus on this articular surface only. And along with that we have this particular gluteus maximus as well present on, or have got little fiber attached to these particular sides as well, little bit attachments of this encroachment of this gluteus maximus. So glue max is present on this particular like angles or lateral mass as well. So these are the like muscles attachment to this particular bones which is present. Now coming to this particular important part about this particular thing, we call them as sacral canal and the sacral foraminus and sacral hiatus. So what gets into the sacral canal and what comes out of the sacral hiatus and this particular foraminus, that's important for us. So let's take this particular easy thing as first. This one, these foraminus comes with the spinal nerves. We call them as sacral nerves. So we sacral nerves have got two divisions. We call them as ventral rami and dorsal rami. Some of the nerve fibers goes on the anterior side, anterior branch, and some of them are on the posterior side. So through these particular foraminus, they comes out with this particular nerves which is coming out here, which is known as sacral nerves. So we sacral nerve have got branches, ventral branch of sacral nerve and dorsal branch of sacral nerve. So we have this particular sacral nerve exiting through here, which call them as dorsal rami and anterior or ventral rami of the sacral foraminus. So posterior sacral foraminus, all of them through here is exiting here is the dorsal rami of the sacral nerves, and on the ventral rami which is coming through this particular ventral sacral foraminus. Clear? So this sacral nerve, ventral branch, and on the posterior side we have the dorsal branch, they are exiting through this sacral foraminus. Now through this particular sacral canal, through this foramen goes in here, we call this nerve as a chorda equina. What is chorda equina? You see that after this spinal cord ends, the nerves which is present hangs like this. So this particular nerve branch, which is like a spinal nerves, all the sacral nerves, we call has a appearance like a horsetail. So this horsetail like appearance we call them as chorda equina. They have like spinal nerves which is hanging down and entering to the canal. So this particular spinal nerve enters to this particular spinal canal, and then with this ventral and dorsal sacral foraminus, these particular nerves comes out of it. So ventral branch comes out with this one, and dorsal one is coming on the posterior side. So this sacral nerves and coccygeal nerves, they get into this particular sacral foraminus or sacral canal, and then this particular thing comes out with this, left with this sacral hiatus. So we have this sacral hiatus at the end. So, through the sacral hiatus what comes out is important here. Through the sacral hiatus comes out all the sacral nerves which is exiting over here, left with this particular nerve which is known as the coccygeal nerve. So, this coccygeal nerve and continuation of this covering of the spinal cord, we call them as meninges. So, these meninges have got like a layers. We have these 3 layers meninges are there: dura mater, arachnoid mater and pia mater. So, this pia mater of this particular thing which is present and covering here, the dura mater is covering here, and all these things covering here is getting out of this remnant of this particular meninges is exiting through here. So, what exits through this particular sacral foramina or sacral canal, that we have to keep in mind regard to whenever we are getting in here. So, pelvic and dorsal sacral foramina through here is coming on ventral plus dorsal rami of sacral nerves 1, 2, 3, 4 like this. Through this particular sacral canal, hello, we have chorda equina plus covering of spinal cord. At this level we just call it meninges. When we talk about this the spinal cord and the covering of it, we will learn the detail of it. I am not keeping it simple right now. So, chorda equina with the covering of chorda equina and the covering of the spinal cord, we call them as meninges or meninges layers getting in this particular sacral canal. And what comes out with the sacral hiatus is coccygeal nerve, and we have continuation of meninges. We call these continuations of meninges as phylum terminali. So, if you can remember this particular continuations of the meninges as phylum terminal, that gets out of this. So, this particular foramens which transmits all these structures, that you have to keep in mind. Pelvic and dorsal sacral foramina through which is nerves are coming. The sacral canal is getting in here is chorda equina. Chorda equina, we understand this particular continuations of the spinal nerve. Detail of the chorda equina we will learn when we are going to talk about this particular spinal cord and this the brain, etc. The covering of the spinal cord, we call them as meninges. So, this particular layers of the meninges that continues with this particular chorda equina through this particular sacral canal. What comes out with this particular sacral hiatus is coccygeal nerves, CO, we call them as abbreviation, we call them as CO1, and then we have this continuations of the meninges, we call them as phylum terminal, or continuation of the meninges is fine at this level is getting out of here. So, these are the nerves which is exiting or coming out of this particular foramens or hiatus, etc., etc. Now, other than these, ventral rami and dorsal rami of the sacral nerve. Along with that, we have sacral vessels, that means artery, and this veins also gets out with this foraminus. If you can remember, other than anything out here is the sacral vessels, that means artery and the nerves. They are also exiting through this particular ventral and a dorsal sacral foraminus respectively. So, to summarize once again into this particular bone whenever you are studying. So, this is a triangular shaped bone, have got like a few features. It has a base, it has an apex, has triangles and the lateral angles or lateral mass we call them as. It has two surface, ventral and dorsal surface. We have this particular part which has got like a central, we call them as base, and the projected part on the sides we call them as ala. And ventral side we have this particular anterior border of the S1 is prominent, we call them as promontory, and in the midline we see this particular transverse ridges, which is nothing but the fused parts of this particular vertebral bodies intervened with this particular intervertebral disc. On the sides we have this particular foramens present on the right side, left side, we call them as ventral sacral foraminus, through which passes ventral rami of the sacral nerve 1, 2, 3, 4 like this, and blood vessels, we call them as sacral vessels, which is getting out of it, right. So, this is a pelvic surface also known as this pelvic sacral foraminus because it is present on the inner side. And apart from that, we have this particular bone which is present on the posterior side. We have the features which is present on here is got like we have the bony bumps we call them as crest. Three of them are there present on the midline to this particular lateral side. We call them as medial sacral crest, intermediate and lateral sacral crest. In between we have this foraminus, we call this as dorsal sacral foraminus, through which transmitting is dorsal rami of the spinal nerve. Spinal nerve have got two branches or two divisions, anterior rami, posterior rami. Posterior rami is getting out of this particular thing along with the blood vessels which is supplying to it. Now, other than this, we have this particular thing which is known as this hiatus, which is present on the bottom side, and this particular upper side we call them as sacral foramen, leads to the canal. Through this sacral canal enter here is chorda equina with the coverings of the meninges, and gets out of the here is that coccygeal nerve, and the remains of this covering we call them as phylum terminal, which is ending or exiting through here. So, two things basically coming out of here in this particular region, right, and this particular ridges and all these like elevations or this particular things which is formed by the fusions of this particular costal ridge or this particular spinous process, transverse process, costal elements, etc., etc. Laterally speaking, we have this part, upper part which is articular part, lower part is non-articular part. Articular part articulates with this hip bone of the ilium side, which is making a joint, sacroiliac joint, right side and left side. Lower part is non-articular, gives attachment to the ligaments which is binding this sacroiliac joint. So, sacroiliac ligaments which is present in here. Other than this, we have the other ligaments, sacrospinous ligament, sacrotuberous ligament. There are names of the ligaments are there, but if you cannot remember the names of them, just don't go for it. Just remember this particular part which is uniting here is making a joint, and ligaments related to this particular joint present to it, if you just want to make it simple. Later on when you learn this pelvis, we will talk detail about these ligaments. They are significant in that context. And on this attachments to these particular muscles, on this side we have this particular piriformis which is attached on the second, third and this particular region, E-shaped attachments, and then we have this iliacus, present on this close to this like ala, and this particular posterior side we have covered over this sacral foramen, we call them multifidus, and erector spinae on the sides, and on the extreme lateral margin we have this glued max, some fibers exiting out to this particular region as well. But these two in the front and these two on the back side is prime thing. And if you just like talk about out of these four, I would say like remember these particular muscles which are present on this pelvic side, like multifidus and the piriformis and this particular coccygeus which is present and on this particular surface. And promontory is that border which is used for marking this particular like measurement of this particular hip joint cavity, we call them as pelvic cavity. So, when you going to talk about the pelvis, we will be coming back once again about this particular point, promontory, and then we talk about the complex things about measurements of the pelvic cavities, etc., etc. We will talk about this once again later on. And apart from that, These are the basic things, and the ala which is present on the sides, which is present on the, have got some features, like it has some kind of like visceral structure as well as some blood vessels present in it. So I just do not want to complicate those things, but basic things is remember with this particular thing on this gross features and the muscle attachment to it. Visceral relation, blood vessel relationship we will learn about subsequently as we move to the pelvis. We will learn about some of the nerves and some of these particular like arteries, etc., then we will talk about that. And regard to this particular bone which is making some kind of joints. So on the sides, right side, left side, we have joint which is sacroiliac joints or joining with this particular hip bone. On top side we have this particular joining with these bones which is lumbar vertebra, right. So lumbar vertebra is present on here. What number lumbar vertebra will be above? L5. So you will be making a joint with this L5 intervened by a cartilage. So lumbosacral joint, and here you have the tailbone, we call them as coccyx. So again we intervened by this cartilage which is present in here as well. So it will be a cartilaginous joint. What kind of cartilaginous joint would be the primary or secondary? There are two varieties of the cartilaginous joint is there, primary and secondary. What is primary and why it is primary, and why is other one is secondary, why it is secondary? কে প্রাইমারি কে সেকেন্ডারি, কে প্রাইমারি স্কুলে পড়ে কে সেকেন্ডারি স্কুলে পড়ে? একটা অসিফাই হচ্ছে, একটা অসিফাই হচ্ছে, মানে কার্টিলেজ ইজ ট্রান্সফর্ম ইনটু বোন। এবার সেটা কোনটা? যেটা রিমেইনস as a cartilage, it will be secondary cartilage. It never gets transformed into bone itself, and that thing ossifies, we call them as primary cartilage. So cartilage becomes bone, we call them as primary cartilage, and if it remains as a bone we call them as secondary cartilage. So এটা কি bones হবে নাকি cartilage থেকে যাবে? Cartilage থেকে যাবে. So if it remains as a cartilage, it will be secondary cartilage joint, and if it is ossified, then it becomes primary cartilage joint. Example, কোন জয়েন্টটা যেটার মধ্যে কার্টিলেজ থাকে যেটা লেটার অন অসিফাই করে যায়? জিফি স্টার্নাম, বিটুইন দ্য স্টার্নাম অ্যান্ড দ্য জিফয়েড প্রসেস অসিফাই করে যায়। ম্যানোব্রিয়াম অ্যান্ড বডি ossify করে যায়, it becomes a single bone. But if it is young, you can get 2-3 pieces of this particular sternum, manubrium, body, etc., gyphoid process, etc. But as the age progresses, this particular cartilage may be ossified. That means cartilage becomes bone. Then it becomes primary cartilage. If it remains as a cartilage, it will be remaining as secondary cartilage. Remember that? And it will be coming again, right? So it will be remaining as the cartilage itself. So it will be a cartilaginous joint, secondary cartilaginous joint, secondary cartilaginous joint. What kind of joint will be on the sides? Sacroiliac joint. What type of joint will be there? It's a synovial type of joint. It has no cartilage as such. It will be having only inherent cartilage. We call them as hyaline cartilage, which is covering this particular bone. So this joints which is present on the sides, which will be synovial joints. For example, এই বোনসটা তো ফিউজড হয়ে গেছে, এর মাঝেও কার্টিলেজ ছিল, it had cartilage before, now it is fused. Now we call them as primary or secondary? Primary. Clear? This is primary joint which is fused over here, that's why we call them, or not calling as any joints anymore. So it is a bone itself. So this is fused bone, so it is a kind of primary ossified completely, which is a kind of primary ossification, but it has never born with, we are never born with it with like this. But when development of this particular bone happened, it happened as a single piece. Later on union take place and we are born like this. Now these are the 4 joints, 1, 2, 3, 4 on the sides. They are present in this particular bone. 2 of them are secondary cartilaginous, 2 of them are synovial type of joint which is present. If it is synovial, movement is pretty much present, possible, and in the cartilage limited kind of movements is possible as well in this particular bone as well. So this is in short about this particular bone. Coming to this last not but least is holding this particular bone in normal anatomical position, which is basically the starting gear. So whenever you are holding this particular bone, you have to identify above and below. which is above, which is below? Base is above, apex is down. So the apex is down, base is above. Anterior and posterior identified by the presence of the rough posterior side and smooth anterior side. So rough anterior side we have this crest, anterior side we have smoother. So this is anterior, this is posterior, right? Then you have to identify medial and lateral. Lateral and medial is identified based on how this particular lateral side is having lateral border or lateral articular margin. So lateral side we have these lateral margins which is present on it. So this is lateral side, this is midline on the medial side. So anterior, posterior, above, below, lateral, medial identified. Now you are holding this particular bone in anatomical position, anteriorly facing the examiner, posteriorly facing yourself, just like your sacral bone you are holding it. Now thing is that this particular sacral bone is tilted down. So this particular thing, when you are standing in anatomical position, this is present in between the hip bone, and because of the position of the hip bone, this particular bone becomes tilted like this. So this particular anterior border which you are seeing here is tilted down. So this anterior border you are seeing here is tilted down. So you have to tilt it as if sacrum is picking up something from the ground. So sacrum ta tola theke tule anle jerokom hoy, as if it is picking up something on ground, ei position rakbe. So you have to hold it in normal positions and then you have to tilt this particular anterior border a little bit downwards. So stone picking movement or stone picking actions, you have to keep it like this, not like this, you have to tilt it down. It will be angled down. Clear? That's all about sacrum. And on this particular sacrum, there is a projections out here which you are seeing here. This is the superior articular facets, which is articulating with the lumbar vertebra, right? So lumbar vertebra, inferior articular facets articulating with this. So again, this particular joint which is present between the lumbar vertebra L5 joining with this particular sacrum bone S1, making this particular joint which is present on here. So we kind of joint, we call them a zygopophyseal joint or facet joint. So these two joints as well is a synovial variety of the joint. So superior articular facets on this side, so it's present in it. So this is about this particular bone. See, this particular bone have got male feature, female feature. You are going to see learn this particular male feature and female feature in pharmacology forensic classes. I am not just going to talk about here in this particular class. So just know about the general features of this particular bone whenever you are studying. Anterior part, posterior part, and this particular structures and different foraminas, name of these different foraminas and significance of this particular foraminas.